Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir, and the topic is classification of the synovial joint. Note, the synovial joints are being classified according to the shape of these articulating surfaces. And if these are plane, let us say it is plane joint. If this condylar, it's called a condylar joint. And secondly, according to the movements permissible at the joint. For example, in one axis permissible, that is uniaxial, and if the movements are permissible at two axes, then we call it as biaxial. And if the movements are permissible in multiple axes or at three axes, then we call it as multi-axis. Okay. Now, the first type is the plane joint. Plane synovial joint are those synovial joints in which the articulating surfaces are plane. For example, you see it over here, the acromion process articulating surface over here, make it clear, and the articular surface at the lateral surface of the lateral end of the clavicle, that is acromioclavicular joint. Over here the articular surfaces are plane, and over here only the gliding movements in multiple direction are permissible. Second type of the joint, synovial joint, or the hinge joint. Like the hinge of the door, you can see the door can open and close, but it can't do up and down. In the same way, in hinge joint, the articulating surface is pulley shaped like that. You can see it over here. In elbow joint, the articulating surface is pulley shaped, and only movement at one axis, flexion and extension is permissible at one axis. So this is uniaxial, and this is the elbow joint. This is the uniaxial or hinge joint. The third type is the pivot joint. Pivot type of synovial joint is like that. Note the point. There is a pivot shaped concave area at one side, at another side the head of the bone or the odontine process of the second vertebra, it fits. Is it clear in the photo? In this pivot, and then it is being surrounded by a rounded ligament, for example the annular ligament, so that the head of the bone can move in rotation all around in this pivot. For example, this radio-ulnar joint, or you can see the atlantoaxial joint. Okay, and in such joint, the rotation is only permissible, and over here, because this rotation, the supination and pronation occur. There is superior and inferior radio-ulnar joints, and then is the condylar or also bicondylar joint. And note, look over here please. These are the convex condyles of the femur, and on the other side you can see the concave condyles of the tibia. So the two convex condyles and the two concave condyles make a joint with one another, and such joint, for example, you can see this knee joint. This is called as bicondylar joint, and over here at this joint, that is the flexion and extension, and a limited amount of rotation is also being permissible at the knee joint. For example, it occurs in locking of the knee, in which there is rotation as well, and in unlocking of the knee, in which there is also rotation. And then another type of the synovial joint is the ellipsoid or elliptical joint. Ellipsoid or elliptical joint are those joints in which Look, there is an oval. There is an oval. Look, an oval concave surfaces at one end, articular surface, at another end, the oval convex surfaces. For example, let us scaphoid and leaflet on one side and the oval surface at the inferior surface of the radius at the carpal joint, at the wrist joint, and this ellipsoid joint, there the moments permissible are, that is the flexion, extension, and then the adduction, abduction, and a limited amount of circumduction is also being permissible at this wrist joint, not full open circumduction. And then another type is the saddle joint. Saddle joint is also called as sellar joint. And over here, again on one side there is a concave articular surface and other side there is a convex articular surface. Concavo convex articular surface articulate with one another, and over here the moment being permissible at this saddle or sellar joint, again the flexion, extension, adduction and abduction, but circumduction and little bit amount of rotation also being permissible over here. And then lastly the most multi-axial and freely mobile joint, that is the ball and socket joint. And this ball and socket joint, there is on one side there is a big socket. For example, you can see this is a tabular fossa in the hip bone, and on another side